Nursing care for the family in need of reproductive life planning. Barrier methods of contraception. Barrier methods are forms of birth control that place a chemical or latex barrier between the cervix and advancing sperm so sperm cannot reach and fertilize an ovum. Barrier methods can help to prevent pregnancy by blocking the sperm to enter or reach the uterus. Spermicides. A spermicide is an agent that causes the death of spermatozoa or sperm before they can enter the cervix. The advantages of spermicide include they may be purchased without a prescription or an appointment with a healthcare provider, so they allow for greater independence and lower cost. Ang spermicide ay mabibili na hindi na kailangan ng reseta at ito ay mabibili sa mababang presyo lamang. The disadvantages of spermicide. A vaginal spermicide can irritate you or your partner's genitals. This irritation increases your chances of getting STIs and HIV. Don't use vaginal spermicides more than twice a day because it will increase your risk of genital irritation. Example of irritation: itchiness, redness, or pain. Spermicide made of. The main ingredients that prevents pregnancy in spermicide is nonoxynol 9. Nonoxynol 9 is a chemical that makes sperm stop moving, preventing it from joining with egg. Spermicide is 72% effective at preventing pregnancy. It may irritate sensitive genital tissue.
A spermicide is a chemical that immobilizes and destroys sperm. Today's spermicides come as foam, cream, jelly, suppositories, and even a thin piece of translucent film that dissolves in the vagina. These products can be inserted directly into the vagina before intercourse, or can be combined with block methods, like a diaphragm or condom, for added protection.
Male condoms. A male condom is latex rubber or synthetic sheet that is placed over the erect penis before coitus to trap sperm. Male condoms have an ideal failure rate of 2% and a true failure rate of about 15% because breakage or spillage occurs in up to 15% of uses. A big disadvantage of male condom is they are one of few male responsibilities birth control measure available. Types of condoms. First, latex, plastic, or lambskin. Most people use condoms made of latex. Second, lubricated. Lubrication or lube is a thin coating of liquid on the condom. Third, spermicide coated. This is a chemical called nonoxynol 9 that kills sperm. Texture condoms. These include rib and stud type.
So you found the right partner and you two have decided to have sex. You've got some mood music, sexy lighting, and of course, condoms. You probably think you know everything about those. So it seems like you're both ready to go. Well, almost. Did you know that condoms are your only contraceptive option that can help prevent both unintended pregnancy and STIs, and are 98% effective when used consistently and correctly? Let's make sure you know how to use that condom the right way. Condoms are easy to use, but mistakes are sometimes made. So let's review some of the mistakes and learn how to prevent them. The most basic mistake you can make is, of course, not using a condom at all. Always use a condom during sex. When opening a condom, use your fingers to tear the wrapper. Never use a sharp object to open a condom. Do not use teeth, scissors, or anything that can damage the condom. When putting on your condom, make sure it isn't on inside out. To put a condom on, place it on the head of the erect penis, making sure the rolled-up ring is on the outside and the tip is up. Squeeze the tip gently and hold it while you unroll the condom all the way to the base of the erect penis. If the condom doesn't unroll, it may be on backwards, damaged, or too old. Throw it away and start over with a new condom. A condom works best during sex when you're actually wearing it, so put it on before you start and keep it on the entire time. Keep your condom on until you ejaculate. Immediately after ejaculation, hold the condom in place and withdraw the penis while it is still erect. Dispose of the used condom by wrapping it in tissue and throwing it in the trash. Make sure to wash up after you're done. Now, condoms are strong and durable, but there are some common sense things you just shouldn't do to them. Make sure your condoms don't get exposed to heat or related damage. Keep them in a cool, dry place, like a drawer. Condoms have an expiration date, usually 3 to 5 years from the date of manufacture. Always check the package to make sure your condom has not passed the expiration date. There are many kinds of condoms you can choose from. Some have unique shapes, ribbing, nubs, all designed to enhance the experience. The majority of latex condoms are lubricated, and some have lubes designed to heighten the experience. However, you may choose to add your own lube. If you do, never use an oil-based lubricant. If using additional lubricant, use one that is water or silicone-based. Now you know how to use a condom the right way, and that they're easy to use, they work, and can even add to the experience. Using condoms consistently and correctly is the best protection against both unintended pregnancy and STIs, so use one every time.
The female condoms are sheets made of latex or polyurethane, pre-lubricated with the spermicide, so the same as male condoms. They offer protection against conception as well as sexual transmitted infection and HIV. The inner ring closed and cover the cervix, and the outer ring is opened and rests against the vaginal opening. The sheets may be inserted anytime before sexual activity begins and then removed after ejaculation occurs. They can be purchased without a prescription, but one more expensive than male condoms. Male and female condoms should not be used together, or there is an increased chance of tearing one or the other. The advantage and disadvantage of female condom. Advantage: available without prescription. Maaari kang bumili kahit walang reseta ng doktor, basta hindi underage. No hormonal side effect. It can be helped to prevent STDs and birth control. Can be used for people with latex sensitivities. Maaari ring gamitin ng mga babae na hindi hiyang sa latex. Prevent STDs. Napipigilan din niya ito sa chlamydia, gonorrhea, herpes, HPV, and HIV. Stays in place regardless of penis, hardness cannot fall off. Maaring gamitin habang nagsisex kayo ng partner mo dahil hindi din madaling matanggal lalo na sa penis. The disadvantage: difficult to use. Pwedeng ma-irritate ang vagina or yung partner mo kung hiyang siya sa latex. Can break or leak. Pwedeng matanggal habang nagmi-make love ang mag-partner or masira. More expensive than male condom. Mas mahal ito kaysa sa condom ng lalaki. Does not contain spermicide. It means walang halong spermicide ang female condom compare sa male condom. Pero maaari pa rin mabuntis ang isang babae.
The FC female condom, created by the Female Health Company, is a condom that is made to be worn on the inside of the body. Before opening the female condom, check the expiration date printed on its package and check the package for any holes or tears. If the expiration date has passed or the package has been damaged, throw it away and begin again with a new female condom. Before opening the FC female condom, gently rub the package to make sure the lubricant is spread evenly. Following the arrow, open the package carefully with your fingers. Take the female condom out of its package, and you will see a thick inner ring and a thin outer ring. The inner ring is used for insertion and to help hold the condom in place during intercourse. The outer ring will remain on the outside of the body, covering the area around the vaginal opening. Before inserting the female condom, find a position that is comfortable for you. You may squat, stand with one leg up on a chair, sit, or lie down. A partner may also help you insert the female condom. While holding the female condom at the closed end, squeeze the inner ring and gently insert it into the vagina. Using your finger, locate the inner ring and push it up as far as it will go, until it rests against the cervix. Be sure that the condom is not twisted. The thin outer ring should remain on the outside of the vagina. As every woman's body is different, it may take practice to insert the female condom correctly. As it will become much easier with repeated use, we strongly recommend that women practice inserting and removing the female condom before using one for the first time during sexual activity. The female condom can be inserted prior to foreplay and intercourse, enabling you to be both safe and spontaneous. When you are ready, gently guide your partner's penis into the female condom's opening. Be sure that the penis is not entering on the side, between the condom and the vaginal wall. The penis must be completely surrounded by the female condom. To remove the female condom, twist the outer ring and gently pull the condom out, then place it in a waste bin. Each female condom can only be used one time. You must remove and dispose of the used female condom and insert a new one before beginning sexual activity again.
What is diaphragm? A diaphragm is a form of birth control that's a shallow cup shaped like a little saucer that's made of a soft silicone. You bend it in half and insert it inside to the vagina to cover the cervix. It fits inside the vagina and to prevent sperm passing through the cervix. The pros and cons of the diaphragm. The pros: it is reusable and relatively inexpensive. It is small and easy to carry. It rarely hinders the sexual experience. The cons: it requires consistent use for each sexual encounter. Spermicidal agents may be messy. A prescription is required. Cervical cup is made of a soft rubber shaped like a thimble, which fits snugly over the uterine cervix. Ito ay isang uri ng silicone cup na ipinapasok sa iyong ari. Sinasaklaw nito ang iyong cervix at pinapanatili na ang semen sa labas ng iyong matris. Kailangan mong gumamit ng cervical cup na may spermicide para madali itong maipasok sa iyong ari. Most girls who use the cervical cup have no problems, but possible side effects may include, from the spermicide, irritation of the vagina and surrounding skin, or an allergy reaction, strong odors or vaginal discharge if the cup is left too long.
Diaphragms and caps are dome-shaped devices made of latex or silicone that are inserted into the vagina before sex. They prevent pregnancy by covering the cervix so that sperm can't get into the womb to meet an egg. The first time you use a diaphragm or cap, you will need a nurse or doctor to help you get the right size. And don't forget, they must be used with spermicide, a sort of gel which kills the sperm. If used correctly, they are 92 to 96% effective at preventing pregnancy. But remember, they don't protect you from STIs, so make sure you use a condom too. Following sex, they need to be left inserted for up to 6 hours. After that, they can be washed and reused. Diaphragms and caps may not be available at every clinic, so it's best to contact them first to ask.
Barrier methods in effect on pregnancy. If conception should occur while using a barrier method, there is no reason to think the fetus will be affected. Some women worry a sperm that survive a spermicide must have been weakened by migrating through it, and therefore reproduce a child with problems. They can be assured conception most likely occurred because the product did not completely cover the cervical opening, so the sperm that reached the uterus was free of the product and unharmed. So, yung barrier methods and effect on pregnancy ay para hindi mag-meet si sperm at si egg cell. By that na hindi sila mag-meet, na prevent natin yung pregnancy. At kung mangyari ang conception habang gumagamit ng barrier method, walang dahilan upang isipin na ang fetus ay maapektuhan.
Barrier methods and effect on sexual excitement. Although barrier methods must be inserted fairly close to the time of coitus, some couples do not find the convenience of insertion only minor problem. If couple is concerned the methods does not offer enough protection, worrying about becoming pregnant may interfere with sexual enjoyment.
Barrier methods and adolescent. Many adolescents use spermicide as their chief method of birth control because of no parental permission or extensive expense involved. When we say spermicides, marami itong iba't ibang klase. It's either cream, gels, films, foams, and suppositories. Meron din itong iba't ibang brands, but they all work in similar way. They are blocking the cervix and stopping sperm from moving. Spermicides also contain chemical to stop sperm from getting to an egg. Adolescents may be fitted for either diaphragm or cups. These diaphragms or cups is a barrier method of birth control. It is moderately effective with a 1-year failure rate of around 12% with typical use. Because an adolescent girl's vagina will change in size as she matures and begin in sexual relation. So example nito is kapag nagsimula ng makipagtalik ang isang babae, nagbabago ang laki ng kanyang ari kumpara nung una, at kung tumatanda na rin ito ay nagbabago na rin. These devices may not remain as effective as they do with older women and so need refitting more often.
Pop culture loves to tell us that a vagina that's experienced a lot of penetrative sex becomes loose. Stretchy things do get loose with time, so maybe that sounds scientific enough? Yeah, right. Stretching out the vagina permanently is a physical impossibility. Why? Because it's a tightly folded muscle, which can expand when it needs to and contract when it's in a resting state. When someone is sexually aroused, more blood flows to the vagina, expanding it to make it temporarily more open. And once the job is done, it can snap right back with ease. If you've understood the biology, you would have figured that this applies to anything that might go into a vagina. A tampon, an index finger, and even your best friend. They will not cause the vagina to become loose. While the size of the vagina may vary from one person to another, this has nothing to do with the frequency of sexual activity. Bottom line, whether someone's had penetrative sex once or 1,000 times, the size of the vaginal canal remains the same. That's another myth in the bag.
Barrier method and the perimenopausal woman. Women older than 35 years have a higher incidence of cystocele or rectocele. Cystocele is when the bladder and vagina wall fall into the vaginal opening. The rectocele is when the rectum bulges into the front of the vagina. So diaphragms and cervical cups may not be ideal contraceptives for them. These are the picture of normal female pelvic and cystocele prolapse and normal female pelvic and rectal prolapse. Spermicide foam can help lubricate the vagina to increase sexual enjoyment in a woman nearing menopause. The use of vaginal film or suppository is not recommended as lessened vaginal secretion might prevent the film or suppository from dissolving completely.